Welcome, everyone. The webcast is about to begin. Take it away, Jeff.
Thank you, Cooper, and hello, everyone. My name is Jeffrey Metz, and I'll be your moderator for today's webcast titled Innovating MSK Health Benefits, What You Must Know. This event is brought to you by BenefitsPro and sponsored by Apos Health. And we thank you all for your patience, and while we worked out some technical difficulties on our end. And before we begin, let's go over some basic housekeeping items about this webcast console. This event is completely interactive and features many customizable functions. Every window you currently see, from the speaker window to the slides to the Q&A panel, can either be enlarged or collapsed. So if you'd like to change the look and feel of your console, go right ahead. If you have a question for our speaker, please enter it in the question panel on your console. We'll ask as many questions as possible during the live Q&A at the end. If we don't get to your question, we do send these over to our speakers after the event, so you may receive an email response afterwards. There will also be a pair of polls during the event, so when one comes up, please answer as best matches your experience. And lastly, a pair of resources from Apos Health have been made available in the Resources tab, so feel free to download so you may review at your own leisure. Now let's get to today's topic and why you all are here. For benefits advisors and consultants, helping clients or employees understand the impact of musculoskeletal conditions on employee health can go a long way to controlling costs and reducing absenteeism among workers. Musculoskeletal conditions are a top cost driver for employers, draining resources, reducing productivity, and frustrating employees. But technology is also playing a more significant role in identifying these problems and providing transformative benefits. And with us today to discuss this and go over this, we have Gus Georgiadis, President and CEO of GG Advisors. Gus, why don't you go ahead and tell us a little bit about yourself?
Good, thank you. And again, sorry for being a little tardy. The technical issues were on my end, and I really apologize for that. So it's nice to be with everybody today. I basically have worked in the healthcare employee benefit space my entire career. For the last several years, I was the area chairman for Gallagher Benefit Services operations in Pennsylvania, upstate New York, based out of Pittsburgh. Prior to that, I had founded Triad USA, which was an employee benefit services firm based in Pittsburgh, and then merged that in 2012 with Gallagher. Prior to that, I had spent about 20 years with Highmark Blue Cross Blue Shield as executive vice president. So my entire career, I've looked at the issue of how healthcare costs are being paid for from both the health plan payer perspective and the employer perspective. And today we'll talk a little bit about musculoskeletal disorders and some things that we all should be thinking about, either as benefit advisors or as leaders of benefits within our organizations. So we move on to the next slide, Jeff, please.
Sure, great. And actually that does bring us to our first poll. So this is multiple selections. What are your biggest challenges when it comes to managing MSK-related costs and employee well-being? And again, it's multiple selections. So is it high healthcare costs, employee absenteeism and lost productivity, lack of effective scalable solutions, employee engagement and adherence to treatments, or just difficulty justifying ROI for new healthcare benefits? And we'll take a few seconds here to go ahead and just let you all select all that best matches your experience, and then we will go ahead and just take a quick look at those results. Again, what are your biggest challenges when it comes to managing MSK-related costs and employee well-being? And this is select all that apply. High healthcare costs, employee absenteeism and lost productivity, lack of effective scalable solutions, employee engagement and adherence to treatments, or difficulty justifying ROI for new healthcare benefits. Okay, and I'm going to give everybody about 10 more seconds, and then we will go ahead and push these results live. Okay, let's take a look here. Okay, so Gus here, the responses are: first was high healthcare costs with about 60%. Next, difficulty justifying ROI for new healthcare benefits. And then with 50%. And then we had 33% for employee engagement and adherence to treatments, 23% for employee absenteeism and lost productivity, and only about 10% for lack of effective scalable solutions. Is this about what you kind of experienced and expected to see?
Clearly, I think obviously, the issue of cost is the driver. And I think that, what we've looked for over the years with any solution, whatever it might have been in any of the chronic condition categories, is always the right ROI. And what we can see is that the lack of engagement seems to be, the issue. So it's, do we have a solution to address the cost problem? Is there an ROI associated with it? And then how do we ensure engagement? So I think these are all, really good pieces of information from the audience perspective as we begin to move forward. And we'll talk about that today. So good to go, Jeff? Next slide.
Yep, good to go. Next slide.
So since this is a discussion about musculoskeletal disorders, I think from my perspective, where we are today is that it's clearly the elephant in the room. The costs are undeniable. MSK costs have doubled over the last decade. And in many instances, when you look at your data, if you're an employer or if you're a consultant meeting with your employers, you're beginning to see, if you already haven't, MSK outpacing cancer, outpacing cardiovascular disease. And that's a problem. And it's a problem because costs continue to rise in the MSK space, and there's no corresponding improvement. It affects almost every segment of an employer's healthcare expenditure, whether it's direct healthcare costs or disability or absenteeism. And we know that from studies that the current approaches in the system, really, which are surgery, imaging, injections, opioids, they just don't work. And so we treat it like a transaction, and that's kind of what we're getting in terms of the results at this point in time. On the next slide, basically the point here is, given what I just said, that if it were an organization, if MSK were a company that had to be viewed by shareholders in terms of whether or not they wanted to invest in it, it would be clearly an underperforming company. It's inefficient, and there's really no returnable measure on investment. But we do know from other chronic condition categories, and what we do know from some research that we've done at musculoskeletal, that to be smart, we need to be early in intervention because we pay less. We know prevention is the least expensive route to go rather than crisis management. And we know that we should be focusing on long-term outcomes rather than quick fixes. And so when we look at the next slide and we think about the impact of knee and low back pain, and we look at it from an employee satisfaction perspective, employees really have experienced reduced on-the-job satisfaction due to discomfort and due to limitations in being able to perform their work-related tasks. Employees with chronic low back pain are really less able to be fully engaged in work, leading to decreased productivity and job dissatisfaction. On the next slide, following through with some of this additional research, we know that when we think about the 12-month prevalence of absenteeism due to chronic knee pain, it's significant in terms of workers that lose an average of 10 days of work. We know that chronic back pain is the leading cause of disability. And we know that when we think about chronic knee pain, it does in fact lead to reduced work productivity and absenteeism and underperformance. From a healthcare cost perspective, on this next slide, we can see that that the costs are also a pretty significant issue. From the perspective of employee satisfaction, from the perspective of rising costs, MSK conditions, really are accounting for more than 30% of total employee medical expenses. And we're seeing, significant costs in terms of lack of productivity, and again, the annual healthcare spending for MSK overall is rather significant. So on this next slide, from my perspective, it's hard to imagine how employers can continue to ignore any innovation in the MSK space. We've talked about cost, we've talked about the impact on productivity and absenteeism, and now we have to ask, the investments we're making, are they working? No, they're not. So there are innovative technologies that help reduce expenses by managing the chronic conditions. We can minimize lost workdays by thinking about how we enhance employee health. We can look at increasing or boosting productivity by making sure employees are healthier. We can focus on enhanced employee satisfaction by understanding and accessing modern healthcare tools. And we can reduce turnover costs by supporting employee healthcare needs. So the question that we ask on the next slide is, whether you're a broker or a consultant, when do you need to act? When is the time to act? When are you ready to act? And then, of course, why should you act? So from my perspective, if you're a broker or a consultant, you really should be ensuring that across all of the chronic conditions that come up in your data analysis, that you're focusing on delivering tangible cost savings. Since we've already established that MSK is among the top cost drivers, how we offer innovative solutions really demonstrates whether or not we're proactive or reactive. And clearly, I've always believed in this, that we want to be in the position of a consultant, of being able to bring solutions to our clients. The last thing we want is for a client to hear about something, to learn about something and bring it to us. We're not that relevant then. We want to be on top of our game and be that trusted advisor that's bringing solutions to our customers. And on this next slide, if we come forward with solutions, then we're really forward thinking, and we're viewed as being forward thinking, and we're viewed as being a partner with our clients. And then finally, it's a client retention move, first and foremost. As you know, if you're the only one speaking to the client and engaging the client around solutions, then you're that partner, you're that trusted relationship, then you're retaining that business. If others get in and offer something that's new and innovative, then that creates a problem. On the next slide, if you're a benefits manager, you really want to continue to be ensuring that you're integrating cost-effective musculoskeletal solutions and programs, because they do save money. We already talked about the impact of cost on the organization, but if we have solutions that are meaningful, then we're saving money. And even though productivity and retention scored lower on the survey, it's still an important point. I still think and believe it's an environment where we want to be able to retain our top talent and attract talent. And if we have a solution for a vexing problem, it'll put us in a better position from a competitive standpoint to retain and attract our talent. And then finally, on this next slide, if we're really in a position of evaluating key metrics and cost savings to really focus on program ROI, then we're being innovative. And I think everyone wants to be innovative and wants to be in front offering innovative solutions. And as a benefit manager in bringing forth solutions, then you're viewed as a key contributor to your organization's success. So on the next slide, again, the point is it's not about innovation. It's really about leadership. Leadership as a consultant, leadership as a benefits manager, and really finding ways to tackle this problem instead of just accepting the costs for what they are. Yes, there always are barriers. There are always ways in which we can find reasons to not do something. But I think given the cost issue and the impact, it's really time to act. It's a crisis today, and it's a crisis that needs to be addressed. So there are a lot of examples for how to be innovative. There's WellDoc, some of you may be aware of it. It's a technology that really focuses on chronic conditions. It delivers real-time personalized health coaching, and employees can make their own decisions. There are cost savings and improved clinical outcomes. It's a good tool using AI. Another example is digital PT. I think a lot of us have used digital PT, whether it's through Hinge or Sword. Maybe there are other platforms as well. And it really, is a way to empower employees by providing digital physical therapy platforms, leveraging AI, using maybe some wearable sensors and virtual physical therapy. It has a role, but again, as you said in the survey, engagement is a problem. A third of you said engagement's a problem. We know continuation of these solutions might not be where we want it to be, and partially it's because it's a solution for a segment of the people with chronic conditions in MSK, but not a total solution. It's one, but not total. And then we have Lynn Health, which really offers a brain-first approach to chronic management. It integrates cognitive, behavioral, and neuroscience-based techniques to address MSK pain. Again, these are all just examples of innovation in the market. You may be aware of them, you may not. The one we'd like to take a few minutes and talk about is Apos. We really think that and believe that this is one of those transformational tools that addresses musculoskeletal conditions. It's an FDA-cleared, FDA-approved device for knee osteoarthritis. It's registered for hip and lower back pain. There are over 70 publications that support the clinical use of this device. It's essentially a shoe that is worn for 30 minutes a day. So it's not a day-long thing. It's something that people wear early in the morning, late at night, 30 minutes a day. And the thesis behind it is that there are pods on the bottom of the shoe that are adjusted based on the gait of the individual. And it really focuses on just improving that gait. And with improvements in gait, it minimizes pain and over time improves mobility and then avoids the need for surgery, injections, and opioid treatments. There are many publications that have recently been reviewed that show 43% reduction in healthcare utilization, translating into more than a 3-to-1 return on investment. There are a number of interesting research studies that are underway today that I'll call qualitative research, where a number of larger employers, jumbo employers, have been brought together to really talk about this device and its applicability. And the feedback is pretty interesting. Ease of use and compliance. Employers really are saying that they appreciate that the Apos device allows users to go about their daily activities without the need to perform additional exercises, physical therapy, extra health visits. It's highlighted as an advantage. They see through the science and the research that there's a prevention of surgery. They believe in the research. They have a strong belief that the product can prevent or delay people from needing surgery, which is simply a compelling reason for adoption. They see the evidence-based and cost-effective use of the product, again, through the research, which is an attractive option. There's the ability to integrate electronic medical records and ability to provide detailed reporting. And then finally, employers have expressed a lot of interest in wanting to think about either implementing it for a segment of the population, finding a way to partner with their TPA, their BUCA, or finding a way to do a pilot. So there's a lot of interest already in this device, and employers have essentially emphasized the importance of elevating the discussion about MSK conditions, which is something that we're doing today, and noting that they're overshadowed by other health concerns. But we think that and the employers have reinforced this, as I said earlier, it's a crisis, it's a ticking time bomb due to the nature and changes in work and demographics. So non-invasive solution could really be crucial in addressing these emerging challenges. And so as we think about wrapping up from what we've talked about today on this next slide, MSK is clearly a significant problem. Costs are out of control. The solutions that we have today, including surgery and imaging and injections and opioid use, just aren't working. It's failed. And that there are a number of innovative solutions, including technology, some point solutions, but there's one proven device that we all should find a way to become more knowledgeable of and aware of, which is the Apos device. It's a chance for each of you to be leaders, either as consultants and leading something dramatic and changeful with your clients, being first to market, or as a benefit manager thinking about a solution that would be innovative, even if it was a pilot for a segment of the population. And we really need to be in a position of helping employees to really get the personal gains that they deserve. Employers have told us this. In the research that we've done, the feedback has been overwhelming. They really want to find ways to leverage discussions, and they really believe that pilots and case studies are good proof points. So we welcome anyone interested in learning more and wanting to maybe engage in a case study. So with that, Jeff, maybe we can move on to some questions.
Yep, thank you, Gus. Thank you. And we are open to our question and answer session. Again, please get any questions you do have for Gus, and we will get to them as time allows. As a reminder also that if we don't have a chance to get to your question, we do send these over to Gus and the Apos Health team, so you may receive email response afterwards. So the first question I have here is, would you consider forward thinking to use offer plans, natural plant-based alternatives to control pain, such as cannabis and or ketamine for pain management, or KAT, ketamine-assisted therapy for mental health? Models are in place already in New Jersey, the person says.
I think there are some models in place, but we've got to be cognizant of federal and state laws. So it's really hard to think about that as a solution across the board. There may be opportunities in some markets based on the law and based on whether or not they're permissible. So, I would view that as more, one-off and more of a particular solution, given, again, the laws and the abilities to implement in states where that exists. I think what we have to do as consultants or as employers is really worry about whether or not we can put something in place that doesn't have any potential side effects or issues. So we can get into a whole nother discussion around cannabis and for medical purposes and how it's produced and whether or not it's safe and efficacious. But I still think the FDA is the right governing body to make some of those decisions, and that just hasn't happened yet with cannabis. On the other hand, the Apos device is FDA cleared.
Okay, great. Now I have a question here about the estimated cost of the Apos program. Gus, do you have any information about that handy or anything like that?
I think that's one of the things that we can put you in touch with the team from Apos with regard to the cost. Just because there are various ways to essentially charge for the product. They're a company that's very forward-thinking and very eager to engage in value-based design. I know that we did some of that, as a consultant with some of the clients that I had been working with previously, where we look at value-based design as a way to implement something like this, which means that essentially the employee should have some skin in the game and not, necessarily have it completely paid for unless they, wear the shoe every day, unless they comply. maybe there's a weight issue there as well. And then obviously, look back and make sure that they're not still going in for shots and that we've avoided surgery. But we do know that there's a good return on investment through the studies. And in the first year of implementation, the studies tell us that it's a 3-to-1 return. So, and a 90% reduction in the need for knee replacement surgery. So there are savings, and they're documented. So that's one of those things that we can have the Apos team follow up specifically with everybody that's interested.
Okay, great. And do you know if Apos is covered by insurance plans or paid for by FSA or HSA or anything like that?
So they are an emerging company, and so a lot of work has been put into getting coverage first. And so they're covered today by Blue Cross Blue Shield of Massachusetts for their commercial products. They're covered by Independence Blue Cross for both commercial and Medicare Advantage, and covered by Highmark Blue Cross Blue Shield, which is across the state of Pennsylvania, upstate New York, West Virginia, and Delaware for all of their commercial population. They're in discussions with a number of other Blues plans, and then have some interesting pilots underway on the commercial side. So coverage is moving forward. I think that, the discussion today and some of the research that's been done and will be continuing to engage in is really finding a way to have some consultants step forward with an interest in wanting to look at this as a pilot for a client or a segment of clients, having an employer step forward with an interest in wanting to do a pilot for their population or a segment of the population. And Apos is more than able to engage in a direct contracting arrangement around that. So, we're not universally covered, but moving in that direction. But we're also able, through Apos, to engage in direct contracting arrangements. And those, as I said, could all be value-based design. So I think it would be a win-win for anybody wanting to take that next step.
Yeah, it sounds like a lot of options to get on this one webcast, and so that email after the event sounds really, really useful there. So let me see here. The next question I have: who prescribes and fits the shoes for employees, and what is the price point? Is there a patient app for it?
I'd have to let the Apos team respond again to the price point, because it's going to depend on just what the arrangement is. So if you want to talk about that, then I would strongly encourage you to reach out directly to them through follow-up after this webinar. There are some applications. There's an app that's used to determine gait and to set those pods initially on the bottom of the shoe. So we can follow up with you on all of those points after this call. So let's make sure that we get that contact information, Jeff, somehow. How do we do that?
We have it all in the records.
Okay, good. That would be great.
Okay, great. So is the Apos solution available in Spanish, both the technology and any support?
I don't know. I'm sorry. I don't want to say something that I don't know.
It's okay. I'm seeing a note kind of in our behind the scenes here that's saying that there is multilingual support. So
multilingual support, great. Thank you.
Great.
I would have assumed, but I didn't want to say something that would be wrong.
Okay, let's get to the next question here. And what is the average period of time that a person would wear the shoe? Have there been any studies on recurrence of injury when stopping to wear the shoe daily?
So as I said earlier, the shoe just simply could be worn 30 minutes a day, either at the beginning of the day before, when you're getting ready in the morning, or at the end of the day. It looks just like a tennis shoe, except it's got pods on the bottom. Some people may think it's not attractive. I think it looks just like a Nike shoe. 30 minutes is the wear time, and I think some of the studies that we can follow up with do show some of that downstream value of having worn it, in terms of not just reduction in surgery, but not the reduction in the need for injections and other follow-up therapy, which would essentially mean that the person is a lot more mobile and safer at work. So it is an occupational health benefit as well from the perspective of what those effects and improvements in lifestyle are in wearing the shoe for 30 minutes a day.
Great, great. So can you tell us what key metrics are most important for you when evaluating new MSK solutions?
What metrics are most important?
Yeah, go ahead.
Yeah, I think it's all based on your data. So I would say that, a consultant or broker should be able to look at data. Data drives decisions, and better understand what's happening with the population. And an employer should be able to do the same. But we should be looking at what's happening to the population as it relates to the musculoskeletal category, and drill down as deep as possible. If you're not using a data warehouse, or maybe if you're not self-funded and you don't have access to the depth of data that you want, you can work with your carrier. But I think it's first and foremost important to understand, how big of an issue is it, and to what extent is the issue driven by surgeries? Is it driven by infections or injections and imaging? And really understand where that compartmentalization might occur from that data, and then begin to think about what extent some of these other solutions might work. There are point solutions that we talked about, and then for the more chronic conditions, how do we apply something like the APOS tool for those members? Because the data is irrefutable, the research is irrefutable. We know that it works. We know that it reduces the needs for surgery. We know that it improves lifestyle. So it's really figuring out how to really isolate that segment of your population, and it can be prescribed by a physical. It depends on how it's being implemented, whether you're doing it through your carrier or in a direct relationship. PT or primary care physician can be involved as well. But I think that it's really important to understand the extent to which this is a crisis within your population, and the extent to which surgeries are driving your costs, and what would the benefit of using a device or tool like this be to offsetting those surgeries and some of those more expensive costs, including injections, and more of the advanced imaging.
Thank you, Gus. And I've got a question here about obesity. So it is understood that obesity can play a key role in chronic knee and hip pain. Is the APOS Health solution something that obese individuals can use without fear of balance issues?
I believe so, but I think it's something that, again, the APOS team can address directly. I have been a lifelong proponent of addressing obesity. I believe that that's a crisis, as well as musculoskeletal is a crisis. And I think for a lot of situations, we need to recognize that they're both medical conditions and need to be dealt with appropriately. I believe that it would be fascinating to see how the APOS device would work in conjunction with, someone that's really serious about losing weight. Again, that would be a great value-based program, where we put skin in the game for both the individual using some of the weight loss therapies that are in the market, along with skin in the game for access to the APOS product. So I think whoever asked that question is onto something really cool and innovative, because that's really something to think about in terms of advising clients and being truly different, right? Because what we're concerned about today is, the cost of the pharmacology on one hand for obesity, and we're concerned about the cost of surgery and all these other downstream issues that pop up for musculoskeletal. So, coming up with some really innovative value-based approaches that combine both would be really, I think, completely innovative. So good question and good idea. That's what differentiates you, I think, in the market, or what will.
Great, that's great. And I wanted to remind everybody, we do have a few more minutes here to please, if you have not submitted your question, please go ahead and get it into the questions widget on your console. We do have, like I said, a little bit of time, so we may get to your question live on air. Otherwise, though, we do send these over to Gus and the Apos Health team, and you may receive an email response afterwards. So you had mentioned, I think, a little while back about some of the applications. So many organizations are exploring digital MSK solutions like Sword, Hinge, and other wearable tech. Have you tried any of these approaches, and what has worked or not worked for you?
So we've tried a lot of them in my prior role as a benefit consultant, and I think what we learned in the research that we've done with these more jumbo employers, that they all have those solutions in place. I think the frustration is that on the one hand, most employers are at a point where they have point solution fatigue, because we've now thrown point solutions at almost every condition category. And then on the other hand, we just don't really have a good sense that there's continuity, that when we bring some of these solutions in, that we have the level of uptake that's really needed to make a change, to improve and to have an impact. And then we just don't know what the continuation is. People do tend to drop off. Again, they're very important solutions, and they play an important role in the continuum. But I think in the end, if we're really focusing in on improving total employee health, addressing the issues that are keeping people away from work, that are musculoskeletal driven, we're keeping them to be less productive while at work, that are musculoskeletal driven, and that our costs are continuing to rise because what's being done isn't working, then I think there's a role for another solution, which is a technology like the Apos device. So I'm not suggesting that none of these other solutions work, because they do have a role and play an important part, but I think there's equally an important role for a device and tool like Apos, because we've got 70 plus studies that are irrefutable in their conclusions, a number of health plans already adopting coverage. And when you look at what's being done in Europe, it's even more profound in terms of how the device is being used, and how, in that kind of a government controlled system, access isn't being made available for some of these surgical and other procedures because the device needs to be worn. So again, I think not saying that these other approaches don't work. I'm just saying that there's a role, and Apos now has a role to play, and we need to begin, I think, thinking about it and considering it, because it's one of these innovations that is going to make a difference for a lot of people.
Great. And so what strategies have you found are most effective in getting employees to engage with MSK solutions?
I think the most important strategy is that the employer buys into it, and buys into it by really making sure that they're embracing and communicating and engaging, because engagement is a critical factor, right? We don't have employees engaged, then we're not going to really have anything from a solution standpoint that's going to work. Secondly, I think the more we can look at value-based designs and putting people in a position to have some responsibility for their own personal health is critically important. And whether we, if we're in a PPO plan design and we charge a higher copay, and we, have that copay reduced over time, if they're compliant, and if the surgeries don't occur, or if it's more of a qualified high deductible environment, then we work on some sort of a value-based approach with a company like Apos. And I think those are the ways in which we really see success. To implement something and just implement it just isn't going to work. And again, the survey, the qualitative research that we've done with employers suggests that as well. They're at a point in time now where they want solutions that have meaningful impact and have solutions that actually work. And we know that this tool works. We know that it's a solution that has an impact. And I think the employer now and the consultant really need to find ways to embrace it and put it in place by engaging employees around it. So it's how we do it, is always the key. But ways in which we do it, I think, putting people at risk and making them accountable is really the fundamental differentiator in any program of this sort.
Okay, great, Gus. Great. Thank you so much for that. And I think we are actually getting near the end of our questions here. We do have a couple more minutes here. So if you did have a question, please get it in, and we will try to get those an email response to you after this event. Otherwise, we do have a quick, just want to hear from you all about how you felt about this presentation and about Apos and its impact on MSK Health and cost savings, and would you like to learn more about implementing it for your organization? So just go ahead and take a second there to respond back to that. Otherwise, we hope you did find today's presentation valuable to you, and thank you all for your time. I want to have a big thanks to Gus for his time and insights, and Apos for their support. I'd also like to remind everybody that this webcast will be archived at benefitspro.com/webcast, so you can view it again or refer it to someone else, and you can explore other upcoming and on-demand presentations while you're there. Have a great afternoon, everyone.